This hi, this is Dr. Executive Plastic Surgery, doing for the measurement. So as you will see, I've just done a 100% total capsulectomy, 7, 23, 25 initials kg. So this is the right side. I removed the excess skin for the contouring purposes. And you can see an intact implant that's nice and round. But on the left side, you will see she had what is a collapsed, ruptured saline implant. This is what happens with saline implants. When they do rupture, they collapse completely, and you will see it has kind of like a significantly reduced volume. It's like a collapsed IV bag, if you will. And again, you will see the full thickness skin. So what I'm going to do is, as you can see, complete removal of the implant capsule. I'm very happy and content with how the whole dissection has gone. It was a very tedious, meticulous dissection. There was a lot of inflammation noted. The patient has what are textured nature implants. And as you will see how thin this is, you can see if I were to take this ruler and put it underneath, you will see how thin this is. And so 100% total capsulectomy has been performed. And as you will see, as I cut open, now the textured implants cause a lot more inflammation. And as you will see, there's some fluid around. And I removed this. The first thing I want to notice here is this small amount of fluid, not enough to send to cytology. But if I go ahead and get this on my new pair of sterile gloves, you can see this is the leaching of the silicone from the silicone shell of the saline implant. And so very slimy. This is your McGann 360, just like the patient said, McGann, what appears to be orophylled. Capsular tissue that's thin. In some areas, look at how thin this is. You can see my blue glove. Some areas thick, but overall I'm very happy and content with how the whole dissection has gone. So the other thing I want to show here is, if I take this, all of this fluid is, should be analyzed, and you will see what is slowly going out into the periphery. And so 360 again. Now I'm going to remove my top sterile glove, and I'm going to focus on what is this known ruptured left saline implant. And so what's interesting is in early 2024, this nice patient talked to me, and then she talked to me a few months ago, and she had what was a ruptured implant, collapsed completely, and you can see how it's small a volume it is. I could literally hide it in my hand. Full thickness skin, as you will see, and complete removal of the entire implant capsule and all of that inflamed tissue. Now, as I cut this open, you will see literally how this implant was sitting, collapsed, and I'm just going to literally pull it out. So there are times where the patients will feel these edges, these pointy edges, and you may think that this is like a mass, but actually in actuality it is that implant that's collapsed on itself. And as you will see, there's a small amount of fluid on the inside, not enough to send, no reason to send. It's not uncommon to see that fluid. And as I have my sterile pair of gloves and I go like this, you can see, look at that stickiness. And definitely a lot more tedious to dissect than the other one. 360 McGann as well. I cannot see where it is ruptured. Let me see. And you can see a secondary capsule starting to form around. Let's send this off. So as you will see right here, this is the entire inflamed tissue removed completely. Sincerely, you can see my glove right here, and I'm overall very happy and content with how the whole dissection has gone. So saline implants, ruptured, you can see there's a significant volume decrease on the one side versus the other. There's also finding of this on the mammogram, and you can see a deflated implant that will clearly be evident on the physical exam as well. As opposed to silicone implants, you could poke it with a needle 10 times, and it would certainly overall retain its volume and not get absorbed. because it is much, much more viscous. So the implants will be returned to the patient, capsules to be sent to pathology, rule out the BIA, LCL, CD for the analysis, rule out lymphoma, rule out malignancy, cultures for aortic and fungal. And most importantly, you'll see how the patient gets. So in this patient, she ended up getting what is truly a common procedure. The implants will be returned to the patient, capsules to be sent to pathology, rule out the BIA, the LCL, cultures for aortic and fungal, twilight deep sedation, no paralysis, high definition pictures and videos of the chest wall showing complete removal of the whole capsule and implant, and removal of all bag inflamed tissue, and not only the capsule but the inflamed tissue, fatty tissue around. No need for the drains, the blood loss was minimal, and no need for that unnecessary lift given her presentation and the amount of breast tissue that she had remaining, which she has a significant amounts. And then every patient, regardless of age or comorbidities, will get the same surgery. And so certainly she may get that 100% full capsulectomy as seen here. This is Dr. Khan, Executive Plastic Surgeon.